Hi, everybody, and welcome to the newly released Beating Diabetes podcast with Dr. Michele. This year, the podcast will be focusing on all things diabetes. And as your host, I'll be recording solo episodes, which will cover some of the most common questions I'm asked as a physician, such as, what can I eat as a diabetic? How can I lose the extra weight that I've put on recently? Is it really possible to reverse type 2 diabetes? What can I do to prevent my children from getting diabetes since it runs in the family? And more. I will also be coaching patients and clients live on air and conducting interviews with other diabetic experts. I hope you enjoy the show. Today, let's talk about diabetes in your feet. One of the things that makes me a diabetic specialist is being a podiatrist for over 22 years. I have seen my fair share of diabetics. I've treated thousands of diabetics over the years and performed surgery on hundreds of them. And probably the least favorite part of my job in podiatry is amputating a person's foot or part of their foot, like a toe, big toe, or 3 toes. And unfortunately, that's what I have to do a lot of the time. And so let's talk a little bit about what leads up to that, because a lot of people that have diabetes or that have a family member with diabetes or friends or have just heard about diabetes because so many people have it now. A lot of these people know that diabetes leads to amputations and diabetes leads to foot problems, but most people don't understand why. They don't understand the mechanism, the physiology behind it. So using simple terms and not using too much medical jargon, I'm going to break it down for you guys today. So this is a typical scene that happens in my office, or a typical patient that will come in. A patient will come into the office with something that looks wrong on their foot, an infection, or they've noticed there's some blood on their sock, or all of a sudden they're having a little bit of pain in their foot and they look down at their foot and their foot looks a little red, a little swollen, but they don't think it's that big deal, but it hurts a little, so they come in. So it either hurts a little, they see blood or drainage on their sock, or someone in their family, maybe their spouse, or someone has told them that they see something on their foot, because a lot of times they can't see their bottom of their feet. They just can't bend that way anymore, or sometimes they don't have good eyesight anymore. So for one of these reasons, they come into my office to see me. And when I ask them for history, it goes something like this. I'll ask them, how long has it been like that? And they don't know, because they just noticed it today, or they just noticed it on the weekend. And it's really hard to get a really detailed, precise history from them to determine how long they've been infected or how long this has been going on, because they don't know. And the reason they don't know is because they have neuropathy in their feet. And so, again, a lot of people have heard the word neuropathy but don't totally understand what it is. So what happens with diabetes when you've had it for a long period of time is there's so much sugar in your system, in your blood, that it coats the nerve endings, and the nerves are not firing properly anymore because there's this kind of like sugar coating on them. So with someone that doesn't have diabetes, let's say they step on a sharp object on the ground, a piece of glass or something like that, right away when you step on that glass, you puncture your skin and your nerve sends a signal to your brain quickly, very, very quickly, instantaneously, that hurts. And you lift your foot off of the glass and you say, ouch, and you bring your foot up and you look at your foot and you see that you stepped on a piece of glass, you see there's blood, maybe you see the piece of glass sticking out of your foot still. You clean it off, you put some medicine on it, and you put a Band-Aid on it, and you go about your day. Well, what happens with diabetic, because they don't have the normal nerve impulses going through anymore because of the glycosylation, that's one of those fancy terms I said I wasn't going to use, but because of the sugar coating on the nerves, when they step on a sharp piece of glass, that nerve impulse that goes up to your brain to tell you that it hurts doesn't happen. So it doesn't register to them because the nerve is not working properly in the foot because of all the sugar that's been coating it. And now the nerve impulses and signals and messages are not getting to the brain, so they don't know that they stepped on the piece of glass. Now, for, a lot of people that have never experienced anything like this, it just doesn't make sense. It's like, can you not tell when you step on a piece of glass? How do you not know when you cut your foot open? How do you not know that you're bleeding all over the place? Well, they don't know because they don't feel it. Their brain didn't get the signal, and they don't even see the blood on the bottom of their sock sometimes right away because of their vision, like I described already. So what happens when they step on a piece of glass is they don't feel it, so they just keep on walking. And the glass could get pushed up into their foot and they don't realize it, and they could keep walking on it. Or maybe it just cut their skin open, but it didn't enter the skin, and so they have a cut there. And so whether there's a cut with glass in it or without glass in it, there's still a cut, an opening. And now that there's an opening there, every step they take, they could be pushing bacteria into their foot. They could be getting infected with each step, getting worse and getting deeper in the foot. And they don't know. They don't notice it. Sometimes they don't see the blood on the floor or on their sock. And so they just walk around like that for who knows how long. Could be a day, it could be a week, could be a month, until someone, either the patient or someone in their family or their home, realizes there's something wrong, because either they smell the infection, because, pus and infections have a certain odor, or one of them sees the bleeding on the sock or inside the shoe, or maybe they just take their shoe off and kick it up on the recliner, and someone across the room says, "Hey, your foot's bleeding," or "There's something on your sock." So this is why the infections go on sometimes for a long period of time before they come in to see me, because they don't even know that they're infected. And when a diabetic has neuropathy to that extent, to where they're not feeling anything on the bottom of their foot, they can step on a piece of glass or a nail and it goes right through and they don't even feel it. When their neuropathy is to that extent, even when the foot gets really badly infected and it has a bunch of pus and it's red and it's swollen, to us, without diabetes, if we felt that, we wouldn't be able to walk on it. When they're to the point where they're feeling that it's kind of sore, looks a little red, a little swollen, their infection has been going on for a while for them to start feeling it. So just imagine, you can't feel a piece of glass entering your skin, but you can feel this red swollen area on your foot. Doesn't make sense, right? So the reason that they can finally feel this infection is because the infection is really, really bad. It might be to the point where it's spread into their bone. It might be to the point where they're already going to need an amputation. It might be to the point where it's into the joint, and it's called the septic joint, an infected joint that we have to do surgery on to drain out the pus. So these are some of the things that I see every day and that I deal with every day and that I treat every day. And some of them end up going to surgery and some of them don't. Some of them we can treat it in the office, and we can drain the infection, give them the right antibiotics, get them off of their foot, because you can't walk around on your foot when it's infected like that. You need to be off of your foot. So there's a lot of things we can do in the office before they need to go on to surgery, before they need an amputation. An amputation isn't something that is automatic when they have an infection. We're going to do everything we can. That's my main job, by the way, as a podiatrist, is to save everyone's feet, everyone that comes into my office. So I'm going to save your foot if I can, and I'm going to do everything I can to save your foot so that you can have a good quality of life and do all the things that you want to do. In those rare cases where I can't save the foot, I can usually save part of the foot or most of the foot. So a lot of times we can just do an amputation of a toe versus an entire foot if we catch it in time. So there's a lot of factors that go into it. You got to catch it in time. We got to catch it before it spreads into the bones, before it spreads into the bloodstream and the patient becomes septic and has to go into the hospital. We need to make sure that their circulation is in order, because if all of these things happen with this infection scenario I'm talking about, and let's say the patient is 90 years old and has very poor circulation in their foot, they have a lot more likelihood of having an amputation than if a 30-year-old patient stepped on that same piece of glass and had the same amount of neuropathy, because a 30-year-old is most likely going to have better circulation than a 90-year-old. However, I have seen some really young people come into my office that have already had an amputation. And, in those cases, we have to figure out what has caused their circulation to go south at such a young age. It could be smoking. It could be vessel disease, meaning that they have clogged arteries or something like that from, like I said, from smoking or from some different conditions that they could have. It's not as common, but it happens. So it's really important that diabetics understand the disease process, this whole physiology of what causes amputations and what causes infections and what can cause these things to happen, because a lot of times they're not educated by their primary care doctors. Their primary care doctor might tell them something like, okay, you have diabetes, here's the medication, here's how you test your sugar, and you have to be careful of any cuts or scrapes that you get on your feet because you can get an infection. And then that's the end of the whole story about their feet and the infections. Or they may say, you need to go see your podiatrist twice a year to have your foot checked for infections. But they don't explain to them the whole story about neuropathy and how that whole cascade of events happens to lead from one person stepping on a piece of glass and ending up having an amputation versus someone without diabetes stepping on a piece of glass and just putting a Band-Aid and cleaning it and putting some antiseptic on it. So that's just a little bit of information for you guys on that. Like I said, this is something that I see every day, and my goal with this podcast and with my health coaching is to educate people and to get them to a point where they understand what's going on and learn how to reverse these things before they end up on the other side of the table, of the operating room table. So if I can help prevent even one or two people from having full-blown diabetes because they're showing early warning signs, and I can talk to them and educate them and coach them on different lifestyle habits and different things they can do to reverse this whole disease process before it gets so far out of hand, then I've done my job. So I wanted to share that with you guys today. I will put my information in the show notes if anyone wants to contact me. If anyone is struggling with some of these issues with themselves or a family member, you can call me. I have some time set aside each week for free calls. It's a 20-minute call. And in case you don't look at the show notes, it's drmichele.com/schedule. And that will get you right to my scheduler, and you can schedule a call with me. So I will talk to you guys next week. Bye. Today's show was brought to you by my coaching program, Beating Diabetes, the 10-Week Roadmap. For more information, head on over to my website, drmichele.com, and click on the Work With Me tab. All of the information is there about my group programs as well as one-on-one coaching. If you have questions about diabetes that you would like me to answer on air, you can email them to me. Just go to my website, drmichele.com/contact, to email your questions. And if you have questions you'd like to discuss with me over the phone, sign up for a free 20-minute coaching call at drmichele.com/schedule.